Lactoferrin's role in mitigating the severity of necrotizing enterocolitis. In this video, we will discuss the current literature on how lactoferrin reduces the severity of necrotizing enterocolitis, or NEC for short, and content from our interview with Dr. Shaiya Robinson. Dr. Robinson is an expert on the topic and has conducted previous research at the Hospital for Sick Children on how probiotics influence intestinal epithelial differentiation. Starting with looking at the table of contents, we will discuss what is NEC, the role of lactoferrin, the importance of mother's milk, and measures to avoid NEC. Necrotizing enterocolitis, or NEC, is a fatal disorder that primarily affects premature infants and very low birth weight infants. Premature infants are born before 9 months and are underdeveloped, and low birth weight infants are infants born in 9 months under the average birth weight. NEC results in intestinal tissue death due to lack of oxygen supply in infants.
In terms of what this actually looks like, if you can imagine the intestine, there are going to be regions, entire swaths of the intestine that are just going to be dead tissue. So in the name necrotizing enterocolitis, necrotizing indicates tissue necrosis. And tissue necrosis simply means death of the tissue. And tissues die when they don't get enough oxygen, okay? So what you have are these really long stretches of the intestine that are necrotic. They're dead. They're no longer alive and supporting tissue function.
Based on our interview and literature, NEC has several causes and risk factors.
These risk factors I mentioned before, so this would be prematurity or early gestational age. Very low birth weight is another risk factor. I also indicated that tissue necrosis arises when there's a lack of oxygen to a tissue. And so reduced oxygen is another risk factor. We call this hypoxia. Another risk factor is formula feeding. So if you have a premature baby or a very low birth weight infant that's formula fed, the risk or the likelihood of them going on to develop NEC is higher than a premature baby or a very low birth weight infant that is fed breast milk.
Another risk factor that Dr. Robinson pointed out during her interview was the composition of the gut microbiome. A composition of the bacterial phyla in the intestine is essential for gut health. Infants who do not have NEC have a higher abundance of a phylum called Firmicutes and a relatively low abundance of a phylum called Proteobacteria. On the other hand, infants with NEC have a greater abundance of Proteobacteria, particularly Enterobacteriaceae, and a reduced abundance of Firmicutes. The signs and symptoms commonly seen in NEC include the following. In affected infants, diminished activity, increased fatigue, gastrointestinal symptoms such as loss of appetite, vomiting, and diarrhea, and visible enlargement of the abdominal area. At further stages in NEC, infants may show symptoms such as respiratory failure and malfunction of the circulatory system. About 7 to 10% of premature babies or very low birth weight infants will develop NEC. NEC has a high mortality rate of about 20 to 30%. The overall occurrence of NEC is approximately 1 to 3 cases per 1,000 live births. Surgical intervention can cause the survival of 40 to 50% of infants that require surgery. Systematic antibiotics are also administered to infants with NEC, and current treatments only increase the likelihood of survival. Lactoferrin is a multifunctional protein that belongs to the transferrin family. The transferrin family is an iron-binding protein that is essential in transporting and regulating iron in the body. Lactoferrin can be found in several bodily fluids, including milk, tears, saliva, and mucus. According to Dr. Robinson, lactoferrin reduces the NEC severity by helping stimulate cell proliferation in the intestinal epithelium. Lactoferrin stimulates cell-tropic effects in intestinal cells such as cellular growth, survival, or proliferation. Infants with NEC have compromised intestinal epithelium, leading to conditions such as sepsis. Lactoferrin helps reduce these risks by stimulating cell proliferation where healthy cells replace damaged cells, leading to re-establishing a healthy intestinal epithelium.
And so this is one way in which we want actually more proliferation to help replace cells that are unhealthy with those that are healthier. Okay, so it helps to reestablish a healthy epithelium.
Lactoferrin also reduces NEC severity by reshifting the composition of the gut microbiome to allow a greater proliferation and abundance of beneficial microbes. As previously mentioned, lactoferrin reduces the NEC severity by promoting the growth of beneficial gut microbiomes. Lactoferrin is a major whey protein in mammalian milk. Lactoferrin has a high survival when it is taken orally. Stomach acids digest lactoferrin to produce a peptide antibiotic called lactoferricin. Lactoferricin helps promote the growth of beneficial bacteria in the gut. When infants with NEC are given breast milk or formula supplemented lactoferrin, there is a slight reduction in the proteobacteria and an increase in firmicutes. According to Dr. Robinson, along with improving innate immunity, lactoferrin also improves adaptive immune responses.
In the publication that I contributed to at Sick Kids, in the mouse model of necrotizing enterocolitis, when we gave these mice lactoferrin, what we saw was a decrease in pro-inflammatory cytokines. So we saw a decrease in tumor necrosis factor alpha, or TNF alpha, and we also saw a reduction in interleukin 6, or IL-6. And these are pro-inflammatory cytokines, and when you give these mice that have NEC, if you give them lactoferrin, we see a reduction in these pro-inflammatory cytokines. So it stands to reason that if you were to supplement infant formula with lactoferrin, that it would help to boost their adaptive immune system as well.
With the information discussed, it is important to note the importance of breastfeeding, as lactoferrin may significantly impact the development and well-being of infants and later. Breast milk has been scientifically proven to help prevent NEC compared to infants who are fed formula. Some measures, such as including lactoferrin in infant formula, reducing exposure to risk factors, and finding interventions to prevent the disorder, can be helpful to avoid NEC. Since NEC occurs almost exclusively in preterm infants, prevention of preterm birth would have an impact on NEC incidence. In addition, exposure to antenatal corticosteroids could reduce the risk of NEC. Therefore, antenatal corticosteroids should be given to all women at risk for preterm delivery within 7 days.